Hi, this is Dr. Elizabeth Young from Lower Lights Christian Health Center. I'm an OBGYN and the Director of Women's Health, and today we're going to review safe pregnancy spacing. I want you to think about what your choices are between your pregnancies, and there's some questions to consider. For instance, how many children do I want? When do I want to stop having children? Do I have what I need to have a healthy family? What are my life goals, and how does having another child impact those goals? The recommended time to wait before you get pregnant again is 18 months. Let's review and consider the reasons why this is the safe interval. So what exactly are the benefits of waiting 18 months? When we consider babies that are born close together, some may be born too early, which is considered premature. Babies that are born premature tend to be low birth weight. They can be small for gestational age. That means depending on how far along you were when you delivered that baby, they can be smaller compared to other babies that were born at the same gestational age. Babies who are born premature are more likely to have long-term health problems, and they can stay in the hospital longer after they've been born because they have a more difficult transition to life. There are also a lot of benefits to you as the mother to wait 18 months between getting pregnant. Mothers that have babies very close together may suffer from certain medical problems like anemia, which can make their blood counts low. And the more babies you have, the more likely you are to bleed a little bit more at the time you have your baby. So mothers that have babies closer together are more likely to die during childbirth. They're also more likely to miscarry their pregnancy. Mothers that wait longer than 18 months to have their baby are also able to breastfeed their babies a little bit longer. There's an increased chance of a woman's uterus opening up, which is called rupturing during labor in women who've had a C-section if they get pregnant less than 18 months between their pregnancies. It also gives the mom time to work on other health problems or to improve their health for future pregnancies. So let's consider what happens during that 18 months. It gives your body a time to heal. Some women develop an infection during the birthing process, and giving yourself time before you get pregnant allows your body to get back to a normal, healthy state and resolve any sort of infection that could have been there. It also gives your vagina a chance to reset the type of bacteria that are normally found in the vagina. It's a big word, the microbiome of the vagina. So waiting that 18 months gives your body a chance to reset that. During that time of waiting between pregnancies, you can also build up the essential nutrients that you need to have a healthy pregnancy. For instance, folic acid is a nutrient that's important in order for the baby's brain and spinal cord to develop normally. Babies also require a lot of calcium to build their bones, and iron is an important component of the red blood cells in a woman's body that helps them to not feel tired or fatigued during pregnancy, and having an appropriate amount of red blood cells also prevents a woman, if they bleed too much during their delivery, from needing a blood transfusion. Let's consider the emotional health of the mother between having babies. So waiting that 18 months, you can enjoy that time that you have with the baby that you've just delivered. You can bond with your baby, spend a lot of time with that baby, and help that baby develop and grow. It also gives the opportunity for your other family members that are helping you raise your baby to bond with the new baby. There can be added stress of having back-to-back pregnancies when your children are really close in age for some patients. So giving that space between the babies where they might be at different stages in their development. So maybe if you wait that time, one of the babies will be walking, sitting up, sleeping through the night, starting to feed themselves a little bit. So giving that time between pregnancies can decrease that stress. Also, Many women can have depression or anxiety after pregnancy, which is very normal as you're adjusting to all the new expectations of motherhood. Waiting that 18 months can also give time for you and your practitioner to work on treating your depression and anxiety so that you can be as mentally healthy as you can be for that next pregnancy. Some women also are in situations where they might be victims of intimate partner violence. Working with your resources and your social workers and your providers can help you get the help that you need to be in a safer situation for you and your children. We also want to consider this time to improve your overall health by making some lifestyle changes. So if smoking tobacco or marijuana is part of your life, it can give you the opportunity to work on decreasing that or stop using that before you get pregnant again. We don't advise drinking alcohol during pregnancy, and patients that drink more than the recommended alcohol use can affect their liver over time, so that can also be a time to work on how much alcohol you're consuming. And of our patients that struggle with other sort of substance use, we have many resources to help patients overcome those addictions. If you find that you're not at your ideal or desired pregnant body weight, this gives us a chance to work with our dietitians, incorporating changes into your food intake and incorporating exercise into your life to reach your healthy weight. And also decrease your chance of diabetes and developing high blood pressure in your next pregnancy. So let's review what can happen with babies that are born too early. Premature birth is defined as babies that are born at less than 37 completed weeks of gestation. And oftentimes these babies can have difficulty transitioning to life outside of the mom by having difficulty breathing, maybe breathing too fast after they're born. They can have difficulty with getting rid of some of the toxins in their blood, which can result in jaundice. And sometimes those babies take a little while to get used to feeding, so they have some difficulties maintaining their blood sugar. Also, once you've experienced a premature birth, for every pregnancy after that, you're at a higher chance of having a baby born at less than 37 completed weeks. So let's talk about how we can space pregnancy to at least 18 months or greater. For moms that are breastfeeding, there's a technical term called lactational amenorrhea, which basically means you might not have a period while you're breastfeeding your baby. This is a very effective form of birth control, especially for the first 6 months of your baby's life, as long as your baby is exclusively breastfeeding. So that means if your baby's only nutrition is coming from your breast milk and no formula supplementation whatsoever, this is a very effective form at preventing pregnancy. Not having sex is also a way to prevent pregnancy. Natural family planning is a way where a woman tracks her cycles and can see other signs in her body so that she knows when her fertile periods are, and she can avoid sex during her most fertile periods. Condoms are a barrier form of birth control that can prevent pregnancy. There's also hormonal birth control and non-hormonal birth control. Reviewing your emotional health again, the greatest benefit of spacing your pregnancy is the opportunity to bond with the baby that you've just delivered, other family members bonding with the new baby, and the decreased stress of back-to-back pregnancies. Now we're going to take a look at some of the forms of birth control that are available to you.